Hey, this is Rozz. Welcome to the DTAP podcast. I've got with me Dr. Grace from DTAP. Now, DTAP stands for Dr. Tan and Partners, and they're a GP Plus clinic with 10 clinics around Singapore. Now, Dr. Grace, I got a question for you. What is GP Plus?
So by GP Plus, we actually mean that in addition to seeing usual GP cases, we also do have additional focus. So specifically, we deal with men's health, women's health, sexual health, and anonymous HIV screening.
Oh, that's cool. That's nice. So you're kind of like the in-between GP and a specialist kind of a clinic. I love that you're, reaching out to the masses with medical information, making it more accessible and all that at DTAP. It's pretty cool that you're doing that.
Yeah, so at DTAP, we actually believe that medicine is not just about drugs or tests. We also do believe that it's about, each individual's personal, physical, and mental well-being. So we hope that, by sharing medical information, we actually be able to help patients to be able to take charge of their own health.
That is so dope. Okay, so today's podcast is all about women's health, and we're going to be talking about what some I call like really embarrassing, shy questions. We're going to be talking about female sexual health in general, some common issues faced by women, with regards to whatever's happening down there. Okay, and I'll be sharing some personal stories as well, like some pretty embarrassing stories. I think the first time I'm actually sharing this on camera. Okay, first let's just dive straight. I know it's the first time we're meeting, but let's just talk about infections.
Okay, so you mean like vaginal
infections. Like what's some of the common infections that you see?
So vaginal infections are actually probably way more common than people think. I think it's just that no one really talks about it to friends. The most common would be things like yeast infections, bacterial vaginosis. So we have patients who, they come in and their main complaint is some sort of abnormal discharge or some sort of discomfort and itching at the, genital area.
Okay, so the most common one, would you say, is like a yeast infection?
Yes, either yeast or bacterial vaginosis, which we also call BV.
Okay, so what does it look like and feel like?
So for yeast infections, typically ladies may complain of stuff like chunky, cottage cheese-like clumpy discharge. Yes, literally that description.
Okay.
Plus maybe itching, swelling, soreness, so it can look quite dramatic.
Yeah. Okay, I'll just come on camera right now to admit that has happened to me as a teenager in secondary school. I was freaked out because the only kind of lumps that come out is, when you have your period, your menstruation. And when you see what do you normally eat at dinner coming out of your body, it's a bit scary. And obviously I didn't talk to anybody about it. And, I'm 42 this year. So when I was 15, there was no Google, I couldn't search for it and definitely wasn't going to tell my friends about it. So what causes it? Because I felt really embarrassed and really small,
so
when
I think,
happened to me.
Yeah, a lot of ladies, they feel embarrassed about talking about it because they wonder if maybe they did something wrong, poor hygiene, all that. But yeast infections can just happen by themselves. Essentially, any sort of disruption to your so-called natural vaginal flora, because there's good bacteria in the vagina. So anything which disrupts that balance could result in a yeast infection. So it could be anything from, hormonal fluctuations during a menstrual cycle to even stress, that sort of thing, pregnancy, yeah.
And does it have to do with what I wear as well? And the weather?
So yes, actually. Interestingly enough, when we're talking about weather, I've had patients who moved from more temperate countries. So they moved to Singapore and they said they've never had yeast infections until they came here. So I'm pretty sure the humidity, does play a significant role. And of course, tight clothes, some ladies who exercise a lot and they practically live in leggings, yeah, they might be more prone to yeast infections as well.
Who lives in leggings in the studio? Okay, so what can we do then to the best of our abilities to kind of keep the vaginal yeast infection at bay?
So while
it can get really embarrassing. Sometimes when you're not prepared for it, you can have a large patch show up in your skirt, when you stand up. I've got a friend that it happened to, and then we had to kind of scramble for a sweater to just cover her up with that.
So while unfortunately there isn't a single special tablet that you can take to permanently get rid of yeast infections, there are certain measures that could be helpful in reducing the risk. So, just practicing good hygiene habits, for instance, wearing breathable underwear, cleansing with a pH-friendly cleanser. Even taking probiotics could potentially be helpful as well, and obviously avoiding stuff like douching, washing inside. Yeah.
What is douching? I know that is an insult, like you call someone a douche because they're, but I never understood douching.
So douching essentially refers to the practice of rinsing inside the vaginal canal, so
Why would
up
you do that?
inside. So some ladies actually think that it is cleaner to do that, or they were taught to do that when they were young. So I've actually had ladies ask me, should they wash inside with water after intercourse, or should they wash inside during their period? And the answer is actually no, because the
Okay.
vagina is a self-cleansing organ. So
Okay.
when you try and clean it yourself, you actually disrupt the good bacterial balance, and then you end up with things like a yeast infection and bacterial vaginosis.
Okay, so too clean is not good as well. You gotta let your body, you gotta
It
trust
will
your
clean
body.
itself.
Yeah, let
Yeah.
your body clean itself. Let your liver detox your body. Let your vagina clean itself. Okay, good. I like that. So, like, how do you kind of can you actually predict yeast infection happening? Like, do you have like a warning sign, like a little cramp or something?
I think for some ladies, they may actually have an inkling as to when it's going to happen, because for some ladies, they actually have a predictable time frame during their cycle or certain specific triggers. So for some patients will tell me, okay, I always get yeast infections before my period. It's
Okay.
always the 3 days before or the 3 days after.
Yeah.
So they just kind of know it's going to happen. Or for some ladies, it's after intercourse. They they always get yeast infections.
So it's just like the volatile environments within.
Anything that disrupts the vaginal, good bacteria and all. Yeah.
Oh man, see, so many women's problems. I can't believe it. And what are the other causes for these kinds of infections? Like what other kinds of infections are there besides yeast infections?
So besides yeast infections and bacterial vaginosis, there could also be infections that could be transmitted
Okay.
from partner to partner. So we're talking more about vaginal STIs or sexually transmitted infections.
Okay, I think I've got an experience with that, HPV, the HPV virus. I think this was around 2008. I went for a full body checkup because a friend that I bumped into on the street insisted that I go for a full body checkup. I think when you're in your mid-20s, you don't think of adulting like that, to invest in a $400 full body checkup. But she insisted I went for it, and then within 2 weeks, the doctors called me back and they said hey, I know this is a bit premature. We're supposed to give you the results in a month, but we need to talk to you. And then it turns out I was at stage 2 pre-cervical cancer. And I was freaked out. I was oh my goodness, what does this mean? And apparently if I waited any longer, it might have been stage 1 cancer. And then I found out that the HPV virus is sexually transmitted. I was but I was in a committed relationship. I never slept around,
So I think, there's a lot of, that we should be talking about HPV more, simply because I feel as if there's a lot of misconceptions
Yes.
about it. So one is that, like you mentioned, a lot of ladies think that, as long as they only have one partner, they're not at risk of HPV.
Yep.
But unfortunately, HPV is so common that effectively, if you are sexually active, you can kind of expect that you might have HPV. And furthermore, you don't actually had to have multiple partners. You just need, if your partner had previous partners, they just need to have one who had HPV for you to potentially be at risk.
Right.
Yeah.
So men are carriers, but they don't actually get affected by HPV.
So men are carriers of HPV, but they don't show any symptoms
Okay.
for the high-risk HPV, and they could transmit it to ladies.
Okay.
And unfortunately, there is no special test for HPV in men.
Okay. Damn. So wait, what does HPV stand for? Let's
So
put it out there.
HPV stands for human papillomavirus.
Papilloma. It's not like butterfly or anything, right?
No.
Okay, yeah. This is I keep thinking papillon. Okay, fine. So the HPV virus, how do I detect it before it gets too severe?
So HPV screening is usually done as part of cervical cancer screening. So for ladies above the age of 30, we recommend doing a HPV test. This looks for high-risk HPV infection in the cervix. So because essentially what happens is one must be infected by HPV for several years before the cell changes happen.
Oh,
Yeah.
okay.
So we're kind of actually, going one step earlier before your cells start to mutate. we want to try and pick up the HPV infection as early as possible,
Right.
so that we know who we need to keep an eye on.
Okay, meaning who's meaning who? Like
So like the
guys.
patients, the patients. So
Okay.
which patients we need closer monitoring just to
Okay.
ensure that, you know, if any sort of cell changes occur, we can deal with that early.
Okay, so when say I get the HPV virus in my body, like it might have been there for a few years before actually showing up on tests.
So not so much that the HPV virus can be picked up once you have the infection, but if you're talking more about pap smear, so a pap smear is essentially when you look at the cells themselves to see whether or not there are any sort of abnormal cell changes. So your cells can be entirely normal, but you could have HPV.
Right. Okay. Wow, man, we
I
go
know,
through
it's
a lot as women.
yeah.
We really go through a lot as women. But you know, ever since I had that experience, like I call it like a close miss. Like, you know, thank goodness for it. I did a quick leap
Yes,
operation.
yeah.
That was like kind of a 20-minute thing, and my gynae had like kind of burnt off some skin, to put it loosely, and then I was kind of healed. And then I found out a little bit more about, like, you know, cervical cancer and how it's like one of the top 10 deadliest cancers in women in Singapore. Is it still the case?
Based on the existing data we have, yes.
Yeah.
Yeah.
And how important is a pap smear? Because I keep telling my girlfriends, look, go for it. Like, you know, once a year at least. Is that enough?
I think once a year is quite a good frequency, actually. If you look at the national guidelines, they recommend the bare minimum is once every 3 years.
Okay.
But of course, you know, what happens during a pap smear is we use a brush and we brush the surface of the cervix
Yeah.
to try and catch any abnormal cells.
Yeah.
So you can imagine, you know, no test is perfect. So there may be a chance that when you do a brushing, there might be a tiny area where the abnormal cells are, but that might be missed. So it may be useful to do it more frequently, like once a year, like you mentioned.
Okay. And is a pap smear enough? Because I've got my gynae who's been trying to like tell me, hey, do you want to do like some, you know, vaccines? And I'm like, how many strains of HPV viruses are there? And then he's like, well, there are a few, but this is gonna like cover most of the dangerous strains. I'm like, nah, I think I'll stick to pap smears.
So pap smears and HPV testing is more for screening, so
Yeah.
to detect, you know, abnormalities when they are already present.
Yep.
But if you want to go one step earlier, then that's prevention,
Yeah.
and that's where the vaccine comes in.
Okay.
Yeah. So I know there are hundreds of strains of HPV, but the good news is that the HPV vaccine covers up to 90% of high-risk strains, or rather, up to 90% of the types which may cause cancer.
Okay.
Yeah.
And my thinking is this, like, and correct me if I'm wrong, okay? Like, if I go for regular pap smears like once a year, which I did when I discovered the HPV virus, if I discovered the virus like within one of those pap smears, I could easily do another 20-minute leap surgery, you know, to get rid of it.
Well, theoretically you could,
Yeah.
but wouldn't it be easier if you never caught the virus?
Okay.
If you were immune to it, and so, you know, even if you're exposed to HPV 16, your body's immune system would clear it off,
Yeah.
which is exactly what the vaccine aims to help you do.
Yeah. And it has proven to be successful,
Oh yes, yes.
foolproof,
Yeah, so-
well researched.
Definitely, yes. Yeah, very well researched. For instance, in Australia, they introduced a nationwide vaccination program, and in the subsequent years, they found that the rates of cervical cancer dropped drastically.
And this vaccine, is it like a one-shot, one-time thing?
So it's a total of 3 doses across 6 months.
Okay. I see like a point there to consider this. Is it too late? Like, you know, I'm 42 this year. Wouldn't this work on someone younger?
So of course, the theoretical ideal would be if you had received it before any sexual activity,
Yeah.
and at a younger age, then your immune system responds better as well.
Oh, that boat has sailed.
No,
For me.
but technically, it's approved in the US for both males and females aged 9 to 45.
Oh, so
Yeah.
guys can take it too.
Yes, males can take it, in fact.
Dudes.
Yeah.
Do it. Okay? Protect your females from the HPV. Oh my goodness. Okay.
Well, there actually is benefit for males themselves.
Okay.
Because the vaccine covers things like genital warts.
Okay.
Yeah.
What are they?
Genital warts. You heard of those cauliflower growths?
Why do you have to associate all these things with food? you know, like cottage cheese, cauliflower. I happen to love those two things, and now I just like
Well,
cannot.
I love those foods as well. So
Okay, yeah, and then you have to actually see the actual thing. So okay, no, I've not seen cauliflower like growth on my genitals, but are they like actually white or like another
they're
color?
generally skin colored.
Okay.
Yeah. Skin colored abnormal looking bumps, and they
Okay.
do sometimes have this irregular sort of surface that really unfortunately does resemble cauliflower.
Okay, and how big can
Yeah.
those bumps be?
It could be really tiny, from just a couple of millimeters all the way to pretty large, like a centimeter or more.
Oh my goodness.
Yeah.
Okay, and can those be cured and gotten rid of, or are they recurring?
So, yes, they can be treated, but unfortunately, they can also recur.
Okay,
Yeah.
and okay, wow, and you get that sexually transmitted
Yes,
as well.
HPV
Both-
again.
Oh, it's also part of HPV.
HPV, yeah.
An extension of it.
HPV 6 and 11 tend to cause genital warts. So
You know-
HPV causes a lot of nasty stuff.
And
yeah.
you probably won't notice this unless you hold a mirror like between your legs and just check,
Yes,
right?
yeah.
And not many people do that. I bet y'all don't even know, like women, I bet y'all don't even know what your vulva looks like. Because I only just started like getting in on like checking out all these little things, like, you know, I mean, what I look like down there, like within the last 5 years. I never sought to look and see.
Yeah, I think a lot of ladies don't actually, I mean, they wash and all, but they don't take a visual look down there. So it is true what you said.
Yeah.
Maybe a lot of ladies may not be so familiar with how their normal anatomy looks.
Yeah.
So I've seen ladies with genital warts that would probably have been there for a while, given the size, but they only became aware of it within the last few days.
And is it life-threatening though?
It's not,
Okay.
but it can be upsetting for individuals and to them unsightly as well. Yeah.
Okay. Well, I mean, the one time I held a mirror down there was when I felt like this pain that just wouldn't go away. It's really, really embarrassing. But because of my cervical cancer history, right, or like my close brush with it, I thought there was a growth on my vulva. And I was like, oh God, this is getting worse and it's not going away. And I know pimples happen down there, like it's common anywhere. Pimples can pop up anywhere. But I felt like this was growing, and to a point where I couldn't even wear my underwear and I couldn't really sit down properly, let alone cross my legs, okay? So I held a mirror down there and I saw this growth in between the vulva. And I was like, oh my goodness, could this be cancerous? And I was like, texting my gynae at midnight. I was like, I need to see you the first thing tomorrow morning. And I went down, turned out to be a pimple. Like what do you call that? Like a lump that he needs.
Cyst?
Yeah.
An infected cyst.
Yeah, it's like one of those things where he needs to come up and drain the pus. Yeah. I was like, I'm so sorry that this is the first thing you have to see and deal with at 8 a.m.
I'm sure he deals with that all the time.
Yeah, his first appointment is at 9, you know. So when he had to see me emergency at 8 a.m. just to cut that out, what a horrible way to start your day, right?
He sees it all the time, I guarantee you.
Okay.
These bumps are way more common than ladies think. Yeah.
Okay.
I see them a lot.
You see them a lot too?
Yeah.
And how do you keep a straight face? How do you like reset your mind and your
It's
it's like
just literally like seeing a sore throat for me. Yeah.
Okay.
Yeah.
nice.
Like no difference honestly. So I feel like patients should just be comfortable because you know, there's no need to feel awkward. You know, we're just all here to help solve the problem.
Yeah. So now that we've known each other, right? Like, I mean, we've had a little chat for like, 20 minutes, and I come to you for like a nether region problem. Are you able to look at me in my face and then not imagine like what you just saw down there?
Yeah, of course. Why not?
Okay,
Yeah.
that's good to know. Because I've always like, forgive me, but I've had really bad experiences with female gynecologists, or like, you know, doctors who are female who have like attended to my, you know, this issue. They tend to be so judgmental. So I've swapped to like a male gynae, and I've told all my friends about it. Look, the guys are gentler. They don't have vaginas, so they don't know that they can take a pounding. So they're like super very careful when it comes to navigating and stuff like that. Well, the girls know, like, you know, we are tough men, so they're like, oh yeah.
I would have thought it would have been the other way around.
No, no, unfortunately for me. But it's good to know that times have changed. Like,
Hopefully, yeah.
I know. It's nice to know. Like, same thing with my dentist as well. Like, you know, I've stayed away from my dentist for like 12 years because of all these like traumas attached to seeing a dentist. But I found out more and more now that dentists are just so gentle. So times have changed.
It's a good step in the right direction, I guess.
Yeah. So from genital warts, obviously, we want to talk about prevention, right? Contraception and some of the misconceptions of these contraceptive methods, like condoms. Let's talk about condoms first. You shared with me that you've had to fish out.
Oh yes, yeah. So, condoms can slip sometimes, and then when condoms slip, sometimes it may be a bit difficult for the lady to pull it out by herself. So I have had patients come to me on several occasions, just to help retrieve the condom.
Okay, and
Yeah.
what's that procedure like?
Also, it's very straightforward. Essentially, how you might do a usual, female pelvic examination. You know how we do a pap smear? Put a little speculum. So
It does not feel little, by the way.
it looks a little like a duck's beak-like thing, gently in to open up the vaginal canal, and then we just use a pair of forceps to fish out whatever needs to be removed.
Okay,
Yeah.
and has like a condom been forgotten in there for like a long time? Have you encountered that?
Maybe not condoms.
Yeah.
But tampons, yes.
Oh my goodness. Okay.
So the
And
whole.
you don't chance upon it until they come for a pap smear.
Well, usually they come in for something unrelated, not really entirely unrelated, but they complain about like a smell or the discharge is odd. Yeah, and then when we actually do a check, then we realize, okay, it's because of a retained tampon.
And how long was that period? Do you roughly know?
Generally, it was like at least a couple of weeks.
Oh dear. So
Because it takes a while before you get the smell and all that.
Okay.
So sometimes ladies really just forget. Yeah.
Okay. Oh my goodness. Okay, I thought that at one point in time it happened to me, and I was like Googling it, and I even tried to fish it out myself. And I texted my gynae again, at midnight, and he clearly ignored me. He was like, if there's no discharge or anything, you should be fine. So is that the only warning sign if I ever lose a tampon in me? If I don't get a weird smell or weird discharge, then it's not lost in me.
Well,
Can it go undetected?
I suppose I don't think it's likely that it will go undetected. Eventually, you're bound to get symptoms. It's just a matter of time. And if you have any reason to think you may have left a tampon inside, it's always worth asking your doctor to help you check. Rather than wait for it to actually become a real medical problem. Yeah.
So now going back to contraceptives, right? Condoms are would say the most popular method for contraception.
I suppose, fairly popular, but now a lot of ladies are more open to better methods.
Okay.
And we're talking about hormonal contraception, daily pills, a patch that you can stick on the skin, and even maybe longer term solutions.
And you're talking about the Yasmins and the Dianes and all that, right? So I was on Yasmin because back when I discovered my stage 2 precancer, I also had ovarian cysts. And instead of doing keyhole surgery, my gynae was like, hey, why don't you just go on these pills and we'll check again in a couple of months to see if they're gone away on their own. And they have. And ever since then, in 2008 till now, I have been on Yasmin, and it's been great for my skin, by the way. And it's also kept my period regular and stuff like that. Not so much for birth control, but I've been trying to get off it. Are there more benefits to stay on it, or cons?
I think it really depends on the individual. It really depends on why you're on the pill, for instance. So if you really do have terrible menstrual cramps that are extremely debilitating, then of course it makes more sense to stay on the pill. Yeah, but if you don't actually have a real need for contraceptive protection, and your periods are fine, there's no huge medical reason why you should be on the pill, then maybe it might be better to
stay off it.
Yeah.
Well, being on the pill keep the ovarian cysts and all those female reproductive system problems at bay.
It may help with some which are hormonally related, but not necessarily all female problems, of course.
Yeah. And if I choose to stay on the pill, would it have an adverse effect on my health?
So the pill is generally very safe, but of course, in individuals with certain pre-existing medical conditions, then it may, increase the risk of things like dangerous blood clots and all. But we always talk to our patients before we come to a decision about whether or not they should stay on the pill or start on the pill.
Okay.
Yeah.
And which do you recommend for a starter kit?
Interestingly enough, there isn't a superior pill. It really depends on the individual's body. So there are so many brands on the market, like you mentioned, Yasmin, Mercilon, whatever. It's trial and error. Yeah.
Okay. Oh man.
So it's kind of good that you found one that you kind of liked.
Yeah, it was like Yaz and then Yasmin. I mean, they're like the same thing, right?
Similar, yeah.
Yeah, and they're really expensive, by the way, guys. It's like $48 a box or something, right?
I guess thereabouts, yeah.
Yeah. Malaysia, Thailand. That does all I'm saying. Okay, so when you talk about sexual health screening, right? How often do you need to do that? Is it? Can you lump it together with general health screening?
I think the unfortunate thing is with a lot of health screen packages that I've seen, they may not specifically include sexual health screening.
Okay.
And by sexual health screening, I'm referring to looking for the presence of any sort of blood or vaginal sexually transmitted infections.
Yeah.
In terms of how often one should do it, it really depends on how active you are. So there's no, there's no cookie cutter guideline that fits everyone. Let's say if you have a new partner, or if you intend to enter a new relationship, then it might always be good to just get your screening done so that you don't have any sort of unexpected surprises.
Okay.
Of course, if you have any sort of unusual symptoms, then that's also a reason to get checked.
Okay.
And finally, if you have any reason to believe that someone could have passed you an infection, then it's always best to just take care of your own health.
And is there like an incubation period or?
So generally, vaginal STIs can be picked up days to a week or so after you catch them.
Okay. Wow. Let me just process this for a while. So before you get into a relationship, it's best that you go as a couple to go get checked.
You could. The year is 2021 after all, right?
Yeah.
So
Hey, the year is 2021. Females are still buying condoms from men. Please.
Are they?
Yes. For some reason, guys are just so embarrassed. I don't know why.
Yeah, so, you were asking me about the couples, right?
Yeah.
Coming for sexual health screening. It can actually be quite a nice thing,
Like a date.
Just be open about it so that you don't have to have any sort of second guessing and all that.
Yeah.
So, we do see patients who come in together and then they just want to get it over and done with. Treat anything that may need treatment before entering a committed relationship.
What are some of in your course of work, what are some of the more bizarre cases you've seen, in relation to sexual health that even stunned you as a doctor? Do you have any?
Bizarre cases. I don't know if it's because I see so many patients every day.
Yeah.
There are tons of interesting cases, but I can't think offhand about. I wouldn't call anything bizarre.
Okay.
But that could also be because I'm just used to seeing everything.
Yeah.
Yeah.
So what are some of the maybe something that it could be useful to people watching? I thought the fishing out condom and the tampon situation, nobody would think that anyone else would have gone through something like this.
Yeah.
And if it happens to us, we'll be too embarrassed to even call our doctor to say, the thing on condoms got stuck in there, can you fish it out,
I think, one thing that I probably would like, patients to know is that there isn't any sort of taboo question. You can just ask, because a lot of times they feel as if this is a stupid question and all, but when we discuss it, it really is an issue. So for instance, some ladies or couples who have issues with sexual intercourse. So there's this thing called genital pelvic pain and penetration disorder. So that's when a lady experiences pain when she attempts to have any sort of penetration or intercourse.
Okay.
And that's usually because of the pelvic muscles kind of involuntarily tightening.
Oh dear.
Yeah.
And rejecting.
Sort of. I'm not too sure if rejecting is
basically saying do not come in, I'm closing the gate shut, and if you come in, I will strangle your penis. Something like that?
Kind of like a closed door almost, yeah.
Oh dear. Okay, so that isn't actually a condition.
It is, yeah. Yeah. So it can, it could affect some ladies to a point where they find it difficult to even have any sort of intercourse.
And what's the solution to that?
So because the problem isn't exactly very simple, it's probably due to, multifactorial, as we say.
Yes,
Yeah.
stress.
Stress, possible psychological,
Traumas?
maybe. Or for some ladies, it's just they're a more conservative sort of approach even. Or just sometimes it could just very well be that your muscles refuse to cooperate. Yeah, so treatment, unfortunately, we don't have any special medicine that we say, okay, take it.
Yeah.
It's a multiple approach. So one would be maybe seeing a pelvic floor physiotherapist. So to
Okay.
kind of teach yourself to control the muscles down there,
Nice.
to learn when you're tensing up, and to in turn know how to relax. And of course, for individuals who feel like maybe the psychological component could be playing a reasonable part, then it's always good to see maybe a sex counselor or a psychologist just to talk things out.
Yeah. Have you ever like, I mean, when you're talking about like partners, like, you know, having intercourse and everything, have you ever like come across, say, a patient with like an erection that just wouldn't go down?
I personally have not, but that can happen, and if it does, it is a medical emergency.
Okay.
Yeah, because it means that the blood is not draining away
Yeah.
from the penis, and that's not good. Yeah.
And say like, you know, a girl is having like an intercourse, or maybe a guy's having an intercourse with his boyfriend, and that happens. What can the partner do?
Call the ambulance.
Call the ambulance, and then
maybe
while
not.
the ambulance is arriving, what can they do to like, you know, soothe the situation?
Okay, maybe I don't know if call an ambulance is the right thing to say given the COVID situation now when
Mm-hmm.
our ambulances are overwhelmed. But well, in the long and short of it is just go straight to the A&E because
Okay.
there is nothing that you can do at home
Yeah.
to alleviate the situation, and you just need to see a specialist quick.
Okay. And when you mean quick, when you say quick, like how quick? Like after a certain period, does it get worse, and you know, or is it just a constant thing that just needs tending to?
It could get worse,
Okay.
yeah, if left untreated, yeah.
And what is the time, you know, barrier? If let's say like, you know, don't let this like, you know, don't hold on to this condition for more than an hour, or like 2 hours, or is there like a time frame that we need to get this sorted by?
I think males generally would know when their erection is not going away, you know. So if it just doesn't go away, I wouldn't say there's a time frame because that's always a dangerous thing to say.
Yeah.
But you know your body best. So if you really do have a persistent erection that is not going away, then it's just safest to see a doctor.
Yeah, and just like throw over a blanket and
go.
go.
Just go. Yeah.
And you're not, and then what about like passing urine and everything? That's not possible as well.
It may be tricky, yeah.
Okay.
I've actually had some couples who come in to ask because they just don't know if they have had intercourse before. Like they come in,
How's that possible?
they come in to consult about fertility, but
Okay.
when we talk to them, it's not really that they've been trying and they can't conceive. They just don't know if they've actually had sex before. Yeah.
With each other.
Yes, that is correct.
But you will know when you have sex because the penis will enter the vagina.
I think it's because you know, not everyone necessarily has had much of a how do I put it, a sexual history.
Okay.
Yeah, so for some couples, you know, when they get married and they start trying for a baby, that's literally the first time that they are attempting to have intercourse, and they
So
probably
they have
also,
nothing to measure it
yes,
against.
exactly.
Okay.
And maybe, you know, not everyone's comfortable talking about this like we do, so they probably wouldn't ask their friends. It would be a weird question, or they feel like it would be a weird question to ask their friends. So the only person that they can turn to is their doctor. Yeah. So in the sort of situation where you know, they don't know if they've had intercourse, I think the most likely answer is that it probably hasn't happened yet. Yeah.
Right.
When you ask a bit more, then you realize that maybe, essentially from the description, you can tell that, you know, they haven't gone through the whole process of penetrative intercourse to ejaculation, which, you know, you need to have a baby. Yeah.
Okay. And you would think something like this is natural, like in the heat of the moment, your body just knows what to do. Then that's not always the case, clearly, as what you just told me.
No, I suppose not. Yeah.
Okay.
Maybe we're too conditioned by, you know, what movies and society tells us.
Porn
It is
videos.
not like it's not like a lock and key that magically fits together all the time. You know,
Okay.
real life is not so.
Yeah. It's not just like, let's go under the covers, move around a little, and
Magic.
that's it. Yeah. So you actually need to, that's, okay, cool. Wow, I never imagined something like that would be, oh my God, okay, I'm still trying to process this. And how often do you see couples like that?
I wouldn't say super often, but it has happened multiple times. Yeah. So I mean, I do think there are people out there who have questions that they want to ask. They just don't know who to ask.
Yeah. And speaking of that, right, like some of the things that you think it could be easy and like, you know, everyone does it, actually, a lot of my friends, I mean, I would consider us to be quite outgoing, quite, you know, cool and quite up to date with trends and all that. But I still do have girlfriends in my age group that don't know how to wear a tampon. Yeah, that was something that I did with my best friend, like when we were like 15 in the toilet in school. Like, you know, we would literally lift up and like, okay, I think this is the angle to do it. Like, because last time they didn't really have like very clear instructions, so we had to figure out the angles. But you can't possibly do that for everybody now, right? Like, you know, adults like just hiding in the bathroom and like, hey, I'm gonna push it in for you. Is there like a foolproof method, like to describe like how to wear a tampon?
So I think I get where you're coming from, because some ladies may not be. I guess it all boils down to awareness about your own anatomy. So if you're not comfortable with how your anatomy is down there, then you won't really know where or essentially how to wear a tampon, and sometimes it could even impact comfort during sexual intercourse. Because the vaginal canal, it's not, assuming a lady, is this too descriptive? No, I don't think it is.
No.
But assuming a lady is lying down, facing up, the vaginal canal is not straight in.
Yeah.
It is kind of down and back. It follows almost the curve of the tailbone, sort of. Yeah. So for some ladies, let's say if they need to put in medicine and all, I'll just tell them to kind of aim gently downwards.
Yeah,
you
a 45-degree angle.
Sort of. Just follow the natural curve of the vagina. Let it guide you. Yeah.
Let the vagina guide you. I like that. That's the quote right there. And that will be like a comfortable way to start learning how to wear a tampon. Like lie down, chest up to the ceiling like you're sleeping. And then
well, whichever is more comfortable for them. I know the usual instructions are put one leg on a surface and then the tampon box shows the toilet bowl back. Okay.
I know. The drawings are so basic, right? That it leaves a lot to guessing.
Yeah, I suppose whatever a lady is comfortable with, there's no correct or wrong.
Yeah, and you're not supposed to feel the tampon once it's
when
lodged
it's in,
properly.
no. Yeah.
Cool. And then try not to get it lost in there. If you do, Dr. Grace will not judge you.
I will help you
She
remove.
will see you with a very poker face, and then,
I can help you remove it, no problem.
Yeah, that's awesome. Well, thank you so much, Dr. Grace, for that.
Thank you for having me.
I would want to live a day in your life. I don't think I have that you know, what's needed, the qualities needed to see like cases like you have like day in and out. But yeah, thank you so much for your insight. And what can we do to keep this conversation going? Is there like a platform that people can turn to if they have more questions for you or the doctors at DTAP?
Well, if anyone has any sort of you know, medical health issues, they are more than welcome to look up our website or email in, and then we will just see how we can help best.
Do you have like that teleconsultation thing?
Oh, we do, yeah.
And is there an app that you need to download for that, or is this online?
Oh no, you know, you can just email in and say you might want to do a teleconsult. We can arrange it for you, no issue.
That's dope. Thank you so much.
Thank you for having me.
And this has been Dr. Grace and Rozz for the DTAP podcast.